Members of the press, citizens of Kenya. Today, the Council of Governors held an extraordinary council meeting to discuss the aforementioned. This is a follow-up meeting pursuant to the extraordinary council meeting held yesterday, 1st of September 2025. We invited the Ministry of Health, the Social Health Authority, as well as the Public Service Commission to deliberate on issues affecting the county government. Following the extensive discussions that we've had, we wish to address as follows. 1. On validation of UHC staff. It was observed that the UHC staff verification exercise undertaken by the Ministry and the Council of Governors has not been finalized jointly. We have therefore resolved that the Joint Technical Committee involved in the exercise immediately convenes to validate and finalize the report. The report is to be ready by Friday, the 5th of September 2025, and is to be co-signed by the PS Medical Services and the CEO of the Council of Governors. 2. On the transition of UHC staff on permanent and pensionable terms. The transition of UHC staff to permanent and pensionable terms. The Council of Governors and the Ministry of Health reaffirmed the position that in the interest of the UHC staff and the public, that transition would only happen on the following conditions. That the requisite resources to transition, which is Kenya shillings 7.7 billion, is availed to county governments through the Division of Revenue Allocation Act, and the county's equitable share of revenue increased. The Council of Governors and the Ministry of Health will work collaboratively to resolve all pertinent issues concerning UHC contracts, and in this regard, a committee consisting of the chairs of Health, Legal, Finance, and Human Resources Committee of the Council of Governors, and which will be also, it will include His Excellency the Governor of Makueni County. So I'll take that again. In this regard, a committee consisting of the chairs of Health. Our chair of Health is Governor Muthomi, seated next to me here. Our chair of Legal, Governor Achilo Ayako. Our chair of Finance, Governor FCPA Fernandez Barasa. Our chair of Human Resource Committee, who is the Governor of Nairobi, Governor Arthur Sakaja, and also His Excellency, the Governor of Makueni, Governor Mutula Kilonzo Jr., will engage with the Ministry and the Union on modalities of paying the UHC workers at SRC rates for the remainder of their current contract. So basically, I want you to get this right. What we are saying is, we would want not to lose the money that's already available to pay these workers at the SRC rates. So this committee, together with the minister's team, will sit down with the stakeholders who are the representatives of these UHC workers, and we agree that their contract runs until the end, which is for most of them April, May 2026. But in this intervening period, we pay them at the SRC rates using the money that the ministry has. And then we transition them to permanent and pensionable if the 7.7 billion to maintain them on permanent and pensionable in perpetuity is included in the next DORA. That's our only condition. Delays in reimbursement on claims from SHA. This is item number 3. The Council of Governors and the Ministry of Health unanimously agreed to roll out a governance dashboard detailing payments of claims from SHA, Social Health Insurance Fund, to county facilities. Currently, counties are owed upwards of 6 billion shillings in unpaid claims. The meeting agreed that all claims should be paid by 14th day of every month. We urge the Social Health Authority to expedite the payment of the pending claims to ensure continued health service provision in public facilities. Number 4, ambulance and evacuation services. It was reported that SHA has made a proposed framework for ambulance and evacuation services to critical patients and interfacility transfer for maternal emergencies. While we appreciate that the conceptualization of the proposed framework, the Council guides that the rollout of the same should be done at a later date. This will allow for consultation between the two levels of government on its operationalization. We appreciate the role of SHA in this, but you will also reckon that ambulance services is a devolved function under Part 2 of the 4th schedule of our Constitution. So we want to give time for consultation so that we agree on the modalities of operating this ambulatory service under SHA. 4, on career guidelines for healthcare workers. We have had an agreement with the Public Service Commission on the career guidelines for various health cadres. These were changes that were made without consulting and involving the county governments as the employers in the development of the said career guidelines. You remember we raised this yesterday. So we have engaged with the Public Service Commission, and in this regard, we shall be calling upon the PSC to withdraw the career guidelines. We have agreed that we will write formally to the PSC requiring them to withdraw these guidelines. Further, we call upon the Public Service Commission to desist from approving cadre-based career progression guidelines, which have a huge financial impact on county governments without having the cost of implementation factored in the equitable share of revenue to the county government. So basically all we're saying is when these changes are made, they have financial implication. If the county governments don't have the money to meet those obligations, it becomes a recipe for strikes. And this is what we're trying to avoid. The Council of Governors, in conclusion, appreciates the fruitful engagement with the Ministry of Health and the Public Service Commission. We believe that the resolutions from this meeting will be honored by the two levels of government to enhance service delivery. And I want to thank the Minister and his team for creating time. As I said in the meeting, the issues that we mostly raise here are things that can be resolved if we consult timeously. And we want to appreciate the Minister because he's been very proactive in coming and saying, can we then talk and resolve these issues? And this is the agreement that we were able to extract as a result of that meeting.
I think from MOH, we had 3 issues. One was on the UHC whole ecosystem. We have agreed, we have gone very far with the validation. We just need to do check a small number of 62 where there's a variance, and we have agreed that should be concluded by, as the chairman has said, by Friday. by both my PS medical service and the CEO of the. So once we finish that, we have again agreed in the interest of further consultation, the committee of the Council of Governors and us from the MOH and the unions will have a meeting, most probably next week, Monday, so that we share with them. But in principle, the money that we have in this financial year that belongs to our staff, who work in our county hospitals. Now we have, we'll give the number after we do the validation on Friday. They will get their salaries beginning September based on the SRC rates. On the transition, the issue that is pending is for us to transfer and for the counties to do permanent and pensionable. The money must be factored in and seen in the Division of Revenue Act. The next Division of Revenue Act is next year financial year. So we have agreed, the money Treasury has provided, so that 7.7 will be transferred and will be factored in and will feature in the Division of Revenue Bill. And that is when the issue of our UHRC finally will be completed. But we want to assure them that the money will not go back. From this September, they will get their SRC. On SHA, the public health sector, which is the Council of Governors, our counties, the hospital they run, are very important. The Council of Governors, led by the chair, were taken through how the claim system works, and they were very, very happy. They asked questions, and we have agreed with them that we are back to the circle. By the 14th of September, a lot of our level 5, level 6, and level 2, 3 will receive their money. Some will receive them before the end of this week, all the verified claims. We have also discussed a very important matter on level 2 and 3, on maternity. Because in our public health facilities, a lot of deliveries take place at level 2, 3, and partly 4. And we will engage with the Kenya Medical Practitioner and Dentist Council, the regulator, with the SHA, and we will find a mechanism where we want our mothers to deliver in hospitals. Safe delivery is in hospitals. So in the far-flung areas within our counties, mothers, and even the number of level 5 hospitals in our counties are not many. So delivery, maternal delivery is something we have agreed. We are going to look at, particularly in the healthcare, in the public health facilities. I think those are mine, and I agree in totality with the chairman on that. Ambulance and evacuations is a new system we are bringing. The governors have been taken through. It's part of the emergency critical and chronic fund. It will be funded by government. But because they're the biggest stakeholder in the health sector and health is devolved, that's why we have given them the first opportunity to take the governors through the framework of the ambulance evacuations that SHA is proposing going forward. Then we go to the private hospitals, then we'll go to the faith-based. But I think today we have started with our biggest stakeholders, the county governments and government public hospitals.